When coaching a patient in health maintenance and disease prevention, be sensitive to his or her cultural background, developmental stage, and possible communication challenges. Take time to prepare for the meeting. Assess factors that may limit the patient's ability to make lifestyle changes. Clarify and address the patient's primary concern and identify any issues that could limit his comprehension. Prioritize the information and determine the patient's immediate and long-term needs. Prepare your teaching area and assemble your supplies and materials. Be sure to use the same equipment the patient has at home. To protect confidentiality and prevent interruptions, meet with the patient in a quiet, private space.
I'm Dana Cummings. I'll be helping you learn about your blood pressure today.
Greet the patient courteously. Introduce yourself and explain your role. Confirm the patient's identity.
Can I have your full name and date of birth, please?
Norman Lepo.
If the room has a computer with internet access, you can show the patient how to research appropriate sites and print patient education materials.
Why don't we begin by looking at some reliable websites you can check for helping you learn more information about your high blood pressure.
Use restatement, reflection, and clarification to promote understanding.
And now let's talk about your blood pressure medications. What questions do you have for me?
How long will I have to take the pills?
So you're wondering if your high blood pressure is short-term or long-term?
Yes.
Well, most high blood pressure is long-term, so you'll probably be taking the medications for your whole life.
I've never been on pills before.
I understand. I know it seems scary taking a pill every day, but just think of it like something you do every day to keep you healthy, like brushing your teeth or eating a healthy diet.
What does sodium mean to me?
Well, sodium is another word for salt, like what you put on your food. So when doctors talk about a low sodium diet, they're just meaning a diet that's low in salt.
I just don't think I can get used to taking the pills.
Now, are you worried about remembering to take the pills?
Yes.
Okay, well, I have something that might be able to help you.
Be aware but respectful of patients' differences and the unique challenges they may be facing. At the end of each teaching session, summarize the material you've gone over together or the skill you've mastered, and outline a plan for the next meeting. Emphasize the importance of following the treatment plan.
Well, it's great that you already know how to use the wrist blood pressure cuff and you have one at home. Keeping track of your blood pressure is a very important step. So let's summarize what we've learned today. Low sodium means low salt, and you know which foods to avoid, right? Now, high blood pressure is a long-term problem, so it's important for you to take your medications every day, even when you're feeling good. Now, you're going to take this pill box and you're going to keep it on your bathroom counter, so that way it will help you to remember to take your medications every day.
Give the patient some take-home materials, or conduct an online search for culturally specific community resources that might be of benefit to him.
So you have everything you need.
Yes. And thank you very much for taking the time to explain it to me.
I'm happy to help. Give us a call anytime if you have questions.
Thank you.
Okay.
Document the teaching intervention and the patient's comprehension, including the material you covered, the patient's response or level of skill performance, your plans for the next session, and any referrals you've offered. Follow up during the patient's next visit.